It is my absolute pleasure to have brought this course together with our colleagues. Good morning, good afternoon, or good evening, everyone, and thank you for joining us for the inaugural UICC Master Course on Financing for UHC in the context of cancer control. I wanted to warmly welcome you all to the Master Course and provide you with a really high-level overview of what we'll be going through over the next coming weeks. My name is Rosie Tasker, and I will be your course coordinator. I work in the Knowledge, Advocacy and Policy team here at UICC as the Global Advocacy Manager. My main role in this job is to focus on much of our global advocacy work, including engaging with the UN high-level meetings, the World Health Assembly, broad cancer prevention, cancer and ageing, and in particular, cancer financing. It is my absolute pleasure to have brought this course together with our colleagues from UICC and other organisations, and I really look forward to engaging with you over the coming months. I also wanted to introduce my colleague Alessandro Di Capua, who's our Senior Manager in Leadership Development, and who's been invaluable in providing much of the technical support for this course. You all should have received messages from Alessandro over the last couple of weeks. And if you have any questions regarding the course structure or the content, you can post these on the discussion forum, which we will touch on a little later. Or if you feel comfortable doing this, please reach out to myself or Alessandro directly at the email addresses on the slide here. So in today's presentation, we're going to explore the background to the course, its objectives, and some of the key topics you can expect to cover. I'll also be providing a short overview of our learning journey, including the assignments and the final task, as well as a few of the different opportunities to interact and discuss with your colleagues over the duration of the course, and actually a really short overview of how to navigate the course platform. So to kick off, a little bit of background. So why financing in UHC? This course has come about in response to UICC demand, with conversations initially starting in 2019 in the run-up to the UN high-level meeting on universal health coverage. Since then, we've seen that financing remains a key building block, with a series of really strong international commitments to improve financing for health and financing for cancer, but that these aren't necessarily translating into action. At the same time, we know that the burden of cancer is growing around the world, and this is putting additional pressure on health systems, and particularly in light of COVID-19. And without substantial and coordinated investment, we won't be able to meet the needs of future cancer patients. All of this is taking place in the context of a lot of myths and misconceptions around cancer. We'll explore some of these throughout the course, but we've heard from you that there is often a feeling when engaging with ministries of finance that cancer can be a black hole for investment. This certainly can be the case where decisions are taken without robust evidence and clear planning, but we also know that there's a whole suite of really cost-effective and high-impact investments which are feasible in every country and every health system, and which will ultimately increase the quality of life and survival of cancer patients, or to help reduce the cancer burden over time. And this is really where we put our focus over this course. Key to driving progress will be building plans to progressively realise the inclusion of cancer in UHC. Now this, for the cancer community, means recognising the difficult decisions that ministries of health have to face when allocating resourcing and choosing where to invest. COVID-19 has been a really good example of this. Actually, we can often mobilise the funds when the need is great enough, but actually, in a lot of cases, this can mean reallocation rather than new money. And actually for us, this highlights the importance of working with ministries and other stakeholders to develop a plan to build health systems and expand services over time. And this is what we really mean when we talk about the progressive realisation of UHC. It's starting from a clear jumping off point. That could be cervical cancer, it could be breast cancer, childhood cancers, it could be prevention, it could be palliative care. And I think it's really important to recognise at this point that no country can necessarily invest in anything irrespective of income level. And so there are always these difficult decisions to make. And actually this is our role as advocates to help member states make those decisions, and particularly ministries of health and finance. So why now? We, as mentioned earlier, we have a whole series of really strong global commitments to deliver UHC by 2030. But the development of UHC takes time, so we need governments to start taking action now in order to lay the foundations to realise UHC by 2030. COVID-19 has demonstrated the critical importance of investing in health way beyond the health sector and the opportunities to mobilise resources when necessary. But we've also seen that COVID-19 has severely disrupted cancer services around the world. There have been a series of high-profile cancer commitments, including the Cervical Cancer Elimination Resolution, the Breast Cancer Initiative, and Childhood Cancer Initiatives launched by WHO over the last year, as well as the Cancer Resolution. And these provide us with a really good window of opportunity of the political will, and that can act as a stepping off point for advocacy. And so this course is one part of the broader response of UICC to support you, our members, in navigating the operational and financial challenges stemming from the COVID-19 pandemic. And we recognise that this is going to be a big part of the work we do for the years to come. So, what are our objectives? So this course aims to provide participants with the theoretical underpinnings of health financing and its core functions to really help lay that foundation for your understanding of how cancer care is financed. We aim to help you understand the role that health financing can play in progressing towards universal health coverage, particularly as it relates to cancer care, and actually start to identify policy options that can improve coverage as part of UHC. We really want to help you to analyse and reflect on your own health systems, assess the challenges that they're facing, and explore some of these policy options. And then really look at how that can become an extra string to your bow in your own national advocacy work. And finally, we want to provide you with the opportunity to explore additional resources and connect with your peers facing similar challenges, but also who've also had successes. We think one of the most exciting things we can do is actually learn from each other. So, about this course and about the syllabus. So the course is purpose-built and it's been developed as a light learning model, and we anticipate it should take about 8 hours to complete the course. The course is asynchronous, which means that you'll learn on your own schedule and within a set time frame. And each of the modules will be released in sequence, and the graphic at the bottom should give you a really quick overview. We would really, really encourage you to try and follow the modules as they're released. This gives you an opportunity to interact with other fellow learners via the discussion forum and the activities. And we've also going to schedule a live check-in session, which is going to take place on or around the 2nd of June. During this live course, you'll have the opportunity to chat to everyone face-to-face via Zoom and pose any questions that you might have. Each of the modules will follow a fairly standard format. There'll be a series of pre-recorded webinars, and this will be between 2 and 4. As well as a couple of podcasts where we'll be interviewing advocates who've been doing this kind of work to share their experiences and their lessons learned. We'll be providing a series of additional resources for you to deepen your understanding and activities to help you put what you've learned into practice. If you complete the course, you'll receive a certificate of completion, but this does mean that you'll have to complete all the steps, including the activities and the M&E surveys within the time frame. So the course will close on the 30th of July with our final activity taking place in the week beforehand. If for whatever reason you're not able to follow the course, or if you have any problems, please do just reach out to myself. So the journey is on, and just to reiterate, we're so glad and we're so grateful that you are joining us for this. The work that UICC does is made meaningful by our members, and these courses are really developed for you. So please do keep in contact with us over the duration of the course. We really want to hear from you how things are going. So what's our learning journey going to look like? This graphic sets out the 5 major modules that we'll be covering over the next few weeks. The introduction will kick off next week with a live session with Miriam Schneidman from the World Bank, and you should be receiving an invite for that today. But one thing I wanted to sort of reflect on with you is actually the course is structured over a series of key questions. Each of the modules will be accompanied by some optional readings where you can find out more about the concepts or the approaches being discussed. But we also really strongly encourage you to do your own reading. This is a whole suite of really interesting articles which may take a much closer focus on different parts of the cancer control spectrum. For example, a greater focus on screening or palliative care, as well as different geographies. If you do find any particularly interesting or useful resources, we'd also really strongly encourage you to share these on the discussion boards. In addition to the didactic modules, we'll be conducting a series of interviews, as I mentioned, and these will come in podcast form. We encourage you just to have a listen to these as and when it works for you. And if you have any questions, please do, again, post them on the discussion forum. All of our presenters are really happy to respond. The final component of each of the modules will be a series of activities or assignments, which will build on what you've learned and the previous activities to explore the context of cancer financing in your country. These activities aren't mandatory, but we really strongly encourage you to complete them week by week in order to be able to shape your final activity, but also to ensure that you aren't falling behind. So these activities should help build you towards developing a final budget pitch. And so you can see in the slide here, Activity 1 will be finding a number of key national documents, and we'll provide some resources which will help support you in that. We'll ask you to start by exploring and reading your own national health budgets to understand where and how cancer is included. We'll ask you to then explore your budget through the lens of a particular issue that's important to you in your existing advocacy work, to develop an ask, and then to do the final pitch. So what do we mean when we say the final pitch? So our final activity is going to be a little bit of a game. I'm not sure if you are all familiar with Dragon's Den or Shark Tank, but it's a program that runs concurrently in the US and the UK, in which cunning entrepreneurs, up and coming inventors walk in and they have to pitch their idea to a series of investors, two of which you can see on the slide here. So we thought we would adapt this slightly, and we will ask you to make a 3-minute pitch to the Ministry of Finance and the Ministry of Health. We'll then ask you to field 3 to 5 questions, and in the end we will vote on, if we were Ministries of Health and Ministries of Finance, who would be successful. We're going to group you all so everyone has the chance to test out your acting skills, and we will ask you to take on that mantle, that role of a Minister of Finance or a Minister of Health, and to help your fellow participants really explore the nuance and the ins and outs of their proposals. And so please, everyone, do get your acting hats on. It's a really, really fun activity. And we'll be providing further information later on in the course, where we'll try and either group you geographically or thematically. The last thing I wanted to touch on were opportunities to interact and network. So we would really, really, really strongly encourage you to chat to each other. While we can't meet physically, we're all here digitally. And actually you have more than 20 participants from 15 different countries representing all the regions in the world and a huge diversity of organizations. Now, how can you interact? We've got the discussion forum. Please do take advantage of it. Pose any questions you may have. If you see questions that you think you're able to answer, share your responses. Let us know what you're thinking. The assignments are a great opportunity to also kind of share your experiences based on what you do day to day. You are the most expert in your own field, and we'd love to hear back from you. I also wanted to reflag the midpoint check-in, so that'll be the 2nd of June. And we'll be scheduling a series of 2 to 3 open Zoom calls for you to pose your questions, share your thoughts on the course so far. If you're having any difficulties, if there are any parts you particularly enjoy, please do let us know. And then obviously there's the final pitch. We're really, really excited about the course, and we really hope that you enjoy it. The final thing that I wanted to touch on was about kind of navigating the course platform. Now, hopefully you're accessing this via our Blue Sky platform, so congratulations for making it thus far. Our capacity building team have been working day in, day out to try and make this as user-friendly and as simple to navigate. We'd really encourage you to familiarise yourself with the full scope of what you can do on the platform by reading the user guide, and you can find there information on how to take surveys and upload your assessments, how to track your progress, how to access presentations and what features there are available, and also to activate and engage in the discussion forum. I think that's everything from me for the moment, but I really look forward to engaging with you all over the coming weeks and months. I wanted to say thank you all again for taking the time to join us. These courses are nothing without the participants, and so I really look forward to hearing back from you all. As I said, I'm just an email away, and you can see my email address up on the slide here. We would very much value any feedback you have. We're here to support you throughout the course, and we really look forward to hearing from you soon. Take care, guys, and speak to you next week.